Most people would probably quote to you the ANA definition, which is the American Nurses Association definition, which is pretty standard and pretty much falls on that same pathway with a little bit of expansion. I kind of have developed for myself a merging of some different ways of thinking in nursing informatics. And the first thing I think that is essential is that it is a specialty. It requires advanced knowledge and skills. It involves the processing, management, communication, and transformation of data to information, to knowledge, and then to wisdom, really to support nursing actions and decisions. But I like what Judy Efkin added in a research article about there ought to be outcomes. We're not just using this technology for technology's sake, but we ought to be doing this to improve cost, quality, safety, satisfaction, efficiency, and effectiveness. So the 5 qualities for any definition is, for me, it has to have advanced knowledge and skills. It involves a lot of data to information to knowledge to wisdom to support appropriate nursing decision and actions to impact client outcomes. Probably the best example I can give you is what we call the case of the ventilator-acquired pneumonia. We have a number of patients that are hospitalized and end up on a ventilator or an artificial breathing machine, and a certain number of those will come down with pneumonia. But we have found over time that there are about 6 or 7 things that if you do, significantly reduces the incidence of ventilator-acquired pneumonia. So a number of hospitals, what they have done is take those 6 or 7 things and put it in kind of like a dashboard. So the bedside nurse giving care can say, okay, need to do oral care, need to make sure the head of the bed's up, need to suction, and they're put on timetables. And if it's overdue, it kind of turns a little red. If it needs to be done, it's yellow. If it's been done, it's green. So you get a data visualization of those 6 or 7 things. It really helps the bedside nurse. This has actually saved millions of dollars in prevented deaths already. If we could take just this example and move it to other healthcare problems, we really could impact the outcomes. Well, I probably came the same route that many of us did, and that was on-the-job training. I had an early interest in computers and a strong passion for nursing. And over time, that really evolved into recognizing the value of using data and information to make a bigger difference in health outcomes. Um, I started out very heavy clinically oriented, mostly in coronary care units, which seems to be where a lot of people that are comfortable with technology, come from into informatics from ICUs and ORs. And then actually I moved my probably informatics into educational informatics and have done a lot at the universities I've been involved with supporting informatics use within academic programs. And the first is to enjoy problem solving, where you can see the bigger picture. You're a systems thinker. They need a passion about nursing with a strong clinical background, strong interest in technology. They need to be a good communicator, or what I call can translate geek speak, and use not the acronyms that we use or the tech terms that we use, but put it in a way that the end user can understand. They need to be detail-oriented, but also thrive on change with a willingness to learn new things, as well as a tolerance for the continual change that's occurring in this area. And to value more than one way to solve a problem. And last but probably not least is being a team player. Remember, this is a multidisciplinary process. Oh, I think so, but a much more grander scale. While you're not impacting a few patients on any given day, you can really impact thousands by making changes in how the data goes to information, goes to knowledge, and change the way healthcare is delivered. The impact is just amazing when you get into the area. I think the first thing you have to look at is where the position reports to within a hospital structure. Is it reporting to an information systems department or the nursing department or administration, quality improvement? Um, you may actually be working with a physician practice in this area, or vendors, or consultation, software design. There are a wide variety of titles currently being used in this area of nursing informatics, anywhere from clinical director of informatics to nurse informaticist to informatics nurse specialist, director of patient care informatics, informatics analyst, clinical informaticist, clinical quality informatics, specialist of nursing informatics. System analysts, clinical analysts, project managers. What we're finding in the area is the titles are starting to standardize a bit. So I think in the future it will be a little bit easier. I'm a little bit old school and I came up where most of us did in terms of on-the-job training. However, what we're finding is at least more than half of those same survey respondents had a master's or a higher degree in nursing or another field. So we're seeing the bar being set because I think of all the changes in healthcare that the expectation is for someone in nursing informatics, a master's is really going to be the preferred degree. What I'm also seeing as a bit of a trend is someone is interested in what we call a chief nursing informatics position or a CNIO. We're seeing more the DNP or the Doctor of Nursing Practice degree being pursued by those candidates. Oh, I think this is the mother lode of what can be done in the future. Um, Everybody knows if we could just get the data, the better evidence-based care. We've had written records for so long that you really cannot capture across cases what's going on. With electronic data and being able to data mine all that data, we can give much better evidence-based care. We can provide real-time decision support at the point of care, not just for the care provider now, we're talking for the care recipient. So the patient or the family also has the data, the information, and knowledge they need to make their appropriate decisions. We're going to have more data available from a lot more different places. It's not just going to be the electronic record. We're talking about mobile apps. We are talking about home monitoring and remote sensing. Think about that for the elderly, where you have devices in the home that's going to be sending data or information either to the family or to a health record. Being able to monitor that in real time where someone is not within a healthcare environment is going to be phenomenal. I think what we will also see is better data visualization schemas and probably better algorithms for care. We're going to start analyzing particular cases and say, okay, these are the 6 or 7 things that really make a difference. So I think once we can get the data across so many different electronic records and really mine that data, looking at patient outcomes, I think that we're going to be a tremendous advantage and really will be doing things differently in healthcare.